Good morning, afternoon, all of it. Wausau, Katie Rosenberg here with my amazing public health compatriot, Lori Scudiere. How are you doing?
Great. Mayor Rosenberg. That's your theme song today.
Awesome. I love having a theme song. We should really think, I always think about like having a walkout song, like before
Ooh,
council and
yeah.
what it would like. I think it would change from meeting to meeting, but I just think
Oh,
it'd be
yeah.
fun. Yeah.
Based on your mood.
Yes. And what we're
Yeah.
about to do.
Yeah. No, we need to discuss this further.
Okay.
Maybe a different video.
Yeah. Okay. If you got suggestions for walkout songs, feel free to comment.
Yeah. Yeah.
Okay. So obviously right now, camp season, I'm hearing about we had a little chat ahead of this video about, what kids are talking about at camp. And it sounds like they're talking about there being a COVID-21.
Yeah.
Uh, what
Which
is
I
going
have,
on here?
which is interesting because it came, that I heard that too. And COVID-21 is not technically a thing. So I think people
Logical
are
sense, I guess.
yeah, it's
Happened.
one of I think they're renaming the Delta variant. I think that's what's happening. There's no technical COVID-21 to my knowledge.
Okay.
Um, the and just a really quick foray into how COVID was named. Co for coronavirus and vi for virus and D, so COVID is COVID, right? So virus, the VI for virus, and then D for disease. And then 19 was because it was discovered as a novel virus, a new virus in 2019. And then we're tracking little mutations in the genetic code.
Yeah.
And so there's different ones that we're tracking. And then there's different levels of interest that we have in them based on, how they transmit and how concerned we should be about them. And so the one that you guys talked about, you talked about with Aaron last week was the Delta
Yeah.
variant. And so that's the one we're really keeping our close eye on. I think that what they mean by that, I think that they renamed it, but really it's still COVID-19. It's just a variant of COVID-19.
Okay, so camp kids, I like where your head is at. I like what you're thinking about. I'm glad. I do hope that you're still catching frogs and going swimming and all of that, but I'm interested. Okay.
I think a lot of very detailed COVID discussions.
No, oh my gosh. Actually, that might be a fun idea for sometime, have kids tell us about COVID. So, or maybe not. I don't know. Maybe we're sick of this. I'm not yet.
I want to know what kids are interested in right now about COVID. So
Maybe
yeah.
we should recruit a parent. Hey, if you've got a kid who wants to talk to us about COVID,
Mhm.
contact me.
Yeah.
Okay, so there obviously are variants. We talked about Delta. And now, I was reading some articles about different kind of breakthrough cases, if you're vaccinated. So, there's some of this like, okay, let's say we had COVID, let's say what's the point of vaccination if I'm still gonna get it?
Right. And in fact, it's so pervasive that the other day I was talking with a nurse, and the nurse had some misinformation and was telling me, like, I don't care about masking anymore. And I was like, what? And so, she was really cool, and I was able to talk with her a little bit. The reason why we want people to remain vaccinated or to get vaccinated or remain masked at certain times is because there are breakthrough cases. And what that means is that even if you're vaccinated, you might get COVID, and chances
Oh,
are, yeah, it might happen. And that's why we want people to stay masked, is because you might have it and you won't know it because you've been vaccinated, and so you might not have many symptoms or any at all, and you could still transmit it to your grandma or to someone you love or to your child, somebody who hasn't been vaccinated. And so that's why we're still asking that people either get vaccinated and or mask when appropriate.
okay. So mask when appropriate, vaccinate. Actually I just talked to someone from Aspirus. They've been vaccinating at the concerts on the square and it's going over really well. So, it's all over. Get it done for free. I know this wasn't on my list of questions, but
Yeah.
still clinics around. Pop into Walgreens.
Yeah.
Actually, I was at Target the other day and you can be like, we have it, walk up, let's get it done. So
And now you can go to vaccine.gov and you can click which vaccine you want. So if you
oh,
prefer Pfizer because you have a child under the age of 18, or if you want to have one shot and you want the Johnson and Johnson, you can click that, and you can find out where in your area, within whatever mile radius you're willing to travel, you can get
Awesome.
vaccinated. So it's really cool and really easy right now.
The
And it's
choice
free.
is
It's free
yours. Oh,
everywhere. Yeah.
yes, it's free. Yes. Go
Yeah.
get some ice cream afterwards. Enjoy life. Cool.
Yeah. Exactly.
Okay. So I guess, you kind of touched on this a little bit in your previous answer, but let's just talk about masking. I know it's kind of hard now um, with everyone kind of universally stopping it in most public places. I
Mhm.
can't even imagine a world where we go back to masking every day, but let's talk about mask effectiveness and when and why and all of that stuff.
Yeah, so masks have been proven to be effective when people are covering both their nose and mouth. So I don't know about you, but I've seen sometimes a half mask
Oh, yeah.
situation, and I have to stop myself because I want to just go up and be like, boop.
Chin
But
strap that's doing nothing.
right, the chin or just over your nose for I don't
Yeah.
know what that is about. But yeah, if it's over your nose and mouth, it's actually proven to block droplets.
Okay.
And so really it's about blocking your droplets and then also blocking any droplets that might be coming towards you. So it's effective in reducing transmission.
Okay.
And so, we still recommend it even in certain circumstances which someone has been vaccinated. And you'll see, in a lot of places like healthcare, you might see masking still on public transportation. I flew last week
Yeah.
and I had to mask the entire time.
Yep.
And actually, it made me
The
feel
federal
great.
transportation, they are still having so on all city buses, all of that.
Hmm. Yep. So we did it. We masked up. I
Oh my
would pop
gosh.
my M&Ms underneath the mask.
Oh my gosh, I'm excited to fly.
Yeah. Yeah, it was funny. I've never been so excited to get on an airplane in my entire life.
I mean, it's been more than a year. Wow. So yeah, I'm planning. I probably shouldn't plan my like halfway around the world trip right now. Like maybe just a little hop over to some, I don't know, New York City.
Yeah. Yeah, no, that's a good point. Katie, if you do plan any travel outside of the US, you want to check to make sure that they're
Yeah.
taking people and that you
Accepting
don't
me.
have quarantine requirements. Yeah. You
Oh
don't want
my
to go
gosh.
for a week and find out that there's a 2-week quarantine because that would be pretty sad for
Oh,
you to
so
be in your home. Yeah.
sad. Hey, good extra tip here. Thank you.
Yeah.
All right. Well, I'm looking forward to next week. Thank you so much as always.
All right. Take care, Katie, and have a great weekend.
You too.